Ciao mondo, hello world, hola mundo, hello mondo, konnichiwa, ni hao, namaste. We're here today in Vicenza at the course on CRRT and AKI, discussing with Professor Gianluca Villa about the upcoming meeting of nomenclature standardization and harmonization of terminology in extracorporeal therapies. In particular, Gianluca was one of the first authors of one of the papers published in Critical Care of the nomenclature standardization initiative of approximately 4 to 5 years ago. And so we're now heading to the next step in this term. We want to standardize terminology of therapies, techniques, and their abbreviation. How do you see this initiative?
The initiative was very important because the Nomenclature Standardization Alliance has already obtained multiple targets and multiple benefits in the field of continuous renal replacement therapy. Multiple stakeholders have adopted the nomenclature defined 5 years ago. Not only users as nurses, physicians, technicians, but every kind of stakeholders now is going to renovate the nomenclature in the field of continuous renal replacement therapy and more generally in extracorporeal blood purification therapies. The aim this year is to include more deeply not only users, adopters, clinically and in the field of research, but also industries, with the intent to build a new kind of nomenclatures that can be adopted in machine, disposables, treatments that nowadays are very complicated. So the intent this year is to renovate the Nomenclature Standardization Alliance to reach in the future other targets that can be spent practically for continuous renal replacement therapy and extracorporeal blood purification therapies.
And we have 3 main groups. The first dedicated to mechanisms, the second dedicated to chronic kidney disease and dialysis and renal replacement therapy in chronic patients, and the third is on renal replacement therapies and extracorporeal techniques in acute patients. So we're trying to cover the entire spectrum of extracorporeal therapies in order to call the same treatment in the same way and in order to use the same abbreviation to indicate a specific kind of technique. With this, I thank you very much for your attention. We're looking forward to have this new meeting in Rome in November, and hopefully this will bring many of the advances that you mentioned. Be careful, your cappuccino is spilling over. All right. Excellent.